immediate implant, it will have to wait and see until we take the tooth out to see how thin the bone is, to see if there's an infection, and what the general health of the site looks like. And once it's all been cleaned out, we assess it, we actually measure the bone, and if we have at least 1 millimeter of bone left around the socket wall, we might put that implant in, do a little hard and soft tissue graft, and that would be called an immediate implant. But more likely what is to happen is that when we take the tooth out, we notice that the bone is less than 1 millimeter thick, which means we can't rely on it. It's going to shrink away. So then what we do, we just simply put a little collagen sponge into the base of the socket to help form a clot, and we just close it up. And we don't do anything. We let it heal up for roughly 6 to 8 weeks. We might have a little temporary restoration ready for you so you never walk out without a tooth. And after 6 to 8 weeks, now the soft tissue is nicely closed up. We now open the site. We're able to assess how much bone was lost. We will place the implant, graft the bone at the same time that we place the implant, possibly graft a little bit of soft tissue, and now we just wait our 2 months until everything heals. This is called a early implant placement. In other words, we don't place it immediately, but we place it roughly 6 to 8 weeks after the removal of the tooth, and it is a much safer way of managing the site so that we don't end up with any aesthetic defects in the future. Now, the final scenario is simply if we take the tooth out and there is so much destruction to the bone due to trauma or infection, and there is no way that we can place the implant, then we just go ahead and graft the socket either at that time or we graft it in 6 to 8 weeks. In other words, we rebuild the socket and let it grow roughly 4 months. And after 4 months, we open up the site now that we have a nice socket, a nice foundation of bone, and then we place our implant predictably at that time. So basically, there are 3 distinct time periods that we could place an implant, either immediately or early, 6 to 8 weeks, or delayed, which is usually 3 to 4 months.
It has to feel good to know that you have so many options to help patients have good oral health, right? I mean, what you just described is amazing, to be able to look in someone's mouth and prescribe for them a plan of treatment that is going to help them out.
It is, Nick, but you know the biggest challenge that we have in implant dentistry is simply always the waiting game. Once people commit themselves to getting an implant, people just want to have things done quickly. And in this society, we're used to having things done very, very quickly.
Yep.
And in our particular profession, that's a real danger. If we cave into that and we do things just for the sake of doing things quickly, we oftentimes pay a very significant price, which takes away a lot of the joy when the final outcome isn't what we were hoping it would be. So it takes a little bit of courage at the time of the treatment to be able to do the right thing and not be completely guided by the fact that we have to do it fast. Let's let nature guide us, because, as we said initially, nature will always humiliate us if we don't respect it.
Well, that's a great place to end. And if you know someone who could benefit from what we have talked about today, please go ahead and share this podcast with them. I'm sure they'll thank you for it. Dr. Ickert has plenty of good advice. And you can reach Dr. Ickert at www.ickertdentalimplants.com. That's ickertdentalimplants.com. And you can always reach his office by telephone at 604-881-1381 or call them toll free at 1-866-931-1981. Dr. Ickert, thanks so much.
Thank you, Nick.
Thanks for listening. At Ickert Dental Implant Center, we are committed to providing you with the very best in modern and advanced dentistry. If you would like more information about dental implants and our extensive range of specialized dentistry services, please call us today at 866-981-1381. That's 866-981-1381. Or visit us on our website at www.ickertdentalimplants.com.
Local stories, local voices. We're localwebradio.fm.